welcome to another segment of Word of Mouth Wednesday. Today I'm honored to be interviewing Dr. Kevin King. Dr. Kevin King is a friend and colleague. He's an endodontist on the northwest side of Chicago. His endodontic practice is called King Endodontics. It's located on Milwaukee Avenue, and you can find him on www.kingendo.com. That's www.kingendo.com. And you can look at his information, and if you ever have any questions, you can contact them. What I'd like to do first is tell you a little bit about Dr. Kevin King. Dr. King graduated from Loyola University School of Dentistry in 1978. He then took his postgraduate training in endodontics at the University of Illinois School of Dentistry. He completed his program there in 1981. He was an assistant professor in the Department of Endodontics at Loyola University. Dr. King is a member of the American Dental Association, the Illinois State Dental Society, the Chicago Dental Society, the American Association of Endodontics, and the Illinois Association of Endodontics. He is a past president of the Northwest Side branch of the Chicago Dental Society and has been a presenter at the Chicago Midwinter Dental Convention. Dr. King served on the board of directors of the American Association of Endodontists. He was the general and scientific program chairman at their annual session in Seattle and Dallas. He served as president of the Illinois Association of Endodontists and the Edgar D. Coolidge Study Group. He grew up in Mount Prospect and attended Viator High School and Loyola University. And again, you can find more information about Dr. King on his website at kingendo.com, www.kingendo.com. And so without further ado, I'd like to welcome Dr. Kevin King today. So I'm really excited to welcome Dr. Kevin King. He's a longtime friend and a colleague. He's from King Endodontics on Milwaukee Avenue, and welcome.
Well, thank you, Claudia. Thank you very much for having me, and I'm looking forward to dispelling all the bad rumors about root canals that people have.
And that's what this is going to be about, because I think of all things in dentistry, probably root canals has the worst reputation and has the most myths that need to be dispelled.
I agree with you. I think they use it as the benchmark for the worst thing that can happen to you in life, and I don't think that's the case at all.
I don't think so either, and comedians tend to make big jokes about it. So we're here to make you feel comfortable about your knowledge about root canals, and you can always send us questions afterward if we haven't answered all your questions. So the first thing I would like to ask you to do is to explain what a root canal is.
Sure. Well, a root canal is a method of trying to save a tooth for a person. When the tooth becomes infected inside, the pulp tissue, what everybody else calls the nerve of the tooth, gets bacteria growing in it. And we try to save the tooth by cleansing out the inside of the tooth and then sealing the inside of the tooth so that the tooth can adequately function in a person's dentition. So that's what a root canal is.
Oh, and so if a dentist tells a patient that they need to have a root canal, what are some of the most common reasons that they would be told that they need to have a root canal?
Well, sometimes a root canal is needed because the tooth has deep decay in it. That's probably the most common reason. Right, and decay, as it extends into the pulp of the tooth, contaminates the inside with bacteria. Many times too, an old restoration or an old filling will crack and will allow bacteria inside the tooth. Sometimes a root canal is needed because of trauma. If a tooth gets jarred in an accident or a playground accident,
Sure.
sometimes it'll cause the tooth to die off and cause a need for root canal work. Sometimes the tooth can be traumatized from grinding. People grind a lot at night and will cause problems like that.
Okay.
So those are some of the common reasons we find that root canals are needed.
One of the things that a lot of patients think is that if they have pain in a tooth, automatically that means that they need a root canal.
Sure, that's a common misconception. There's so many different things that can cause pains in teeth, and not all of them are root canals. I mentioned grinding. Sometimes people grind their teeth and it can cause short-term pain in the teeth. There's a lot of components to the tooth that are not part of the nerve itself, like the bone around the tooth, and that will cause pain. Periodontal problems or gum-related issues will cause pain for a person. Sometimes if people are involved in more chronic diseases like neuralgia, they can get pain in a tooth. And that's one of the things that we do as endodontists, is try to categorize where the pain is coming from. We don't just automatically treat a tooth for a root canal because a patient is having pain. Sometimes the pulp or the nerve can get jarred, and it's a transitional thing. And it'll set the tooth off for a while, and then it will settle down. And so our job is to determine why there is pain or what the cause of the pain is, and then if it is an indication that root canal work is needed.
Okay, so I think a message to people out there is that if you're having pain in a tooth, the best thing to do, rather than assume the worst, is to contact your dentist, or if you have an endodontist that you've gone to just make sure that the diagnosis is correct before you think automatically it's going to be a root canal. So that's a really important thing. And a lot of people, because of the fear of root canals, don't know what goes on in the office when you are going to perform a root canal. And so maybe you can walk us through that.
Well, the first thing, as I mentioned, is we have to determine if a root canal is needed. So when the patient comes into our office, the first thing we would do is a series of tests. And we would test the tooth with both hot and cold. We would test the tooth by tapping. We would use x-rays and look to do different tests to make sure that the tooth does in fact need to have root canal work. After we determine that the tooth does need to have root canal work, then the first thing we would do is sit down with the patient and explain to them quite a bit as to what to expect, why we're doing things, and we spend a lot of FaceTime with the patient just talking to them, which I think is very important.
Reassuring.
Absolutely. I think the patient needs to be comfortable before you start anything. So after we get the patient comfortable and get them to know what's coming, then we begin the root canal itself. And the root canal can take sometimes one visit, sometimes two visits. That's kind of dictated by Mother Nature, and it depends on the status inside the tooth. So we get the patient very, very numb, and just using the same local anesthetics that you would use for a filling. So you just have the numbness, and then we go make a little opening in the plating surface of the tooth and go inside and cleanse out the inside of the tooth. If you think of the tooth as a pencil, we're taking the lead out of the pencil.
Oh, that's a good analogy.
People say you're taking the root out. You're not actually taking the root out.
I was going to say that. A lot of people think that they no longer have a root after they've had a root canal.
Exactly. And the root is what holds the tooth in place. And if it were not for the root, then we wouldn't have the tooth. So we are basically cleansing out the inside of the tooth. And then after the inside of the tooth is cleansed, then we have to make a determination on the degree of the infection inside the tooth. And this is where we decide whether it's a one-visit step or 2 visits. And if we need to put a medication in the tooth because of the infection, then we'll close up the tooth with a temporary filling. And the patient will leave the office at that point in time and come back a week to 2 weeks later, and we go back in through that same temporary filling and take out the medicine that has worked inside the tooth and replace it with a permanent sealing material. That material is called gutta percha, and that goes down inside the tooth. And then after we finish the root canal, then the patient goes back to their general dentist for the restoration of the tooth. So, and usually they'll place a crown over the outside of the tooth if the tooth does not have a crown on it already.
That was going to be one of our questions that I know patients ask us all the time about. If I have had a root canal, does that automatically mean I need to have a crown?
Yes, most of the time we do suggest a crown. And the reason we suggest a crown is because the tooth, after it has had root canal work, is more susceptible to a crack or a break. And by protecting it with a crown, you limit the possibilities of a crack or break. It doesn't totally eliminate it, but it improves the chance that the tooth can hold up quite well. Many times we're doing a root canal through a tooth that has already had a crown, already has a crown on it. And that does not mean that the tooth needs to have a new crown. So what we will do in a case like that is make a small little opening in the crown and work right through the crown. And then the general dentist can repair the crown or close up the crown again, and the crown functions as good as new again.
And one of the $64,000 questions that I know everybody's waiting to hear is, are root canals painful?
We get asked that a lot, and as Madison Avenue marketing has always showed that the root canals, as I said, are the worst thing that could ever happen to you, and really nothing could be further from the truth. With today's modern pain control with the anesthetics, I would say the great majority of the people come into our office and walk out and say it's as easy as having a filling done, if not easier many times. And they're actually quite surprised by the whole process.
Right.
But as in anything, there's exceptions to every rule, but the great majority of the time I would say people find it to be a very comfortable experience.
And I know for a fact that the patients that we send to Dr. King's office are exactly what he's saying. They come back and they say, oh my gosh, it wasn't bad at all. I thought root canals were going to be horrible. So I think good anesthesia is really one of the, the keys here. And
the abilities we have to get people numb now compared to years ago is just like night and day difference. And we try to make it an experience that is a pleasant one.
Right.
I won't go as far as saying fun, but
right.
Although we do have a good time with a lot of the patients.
We always have a good time at your office, actually. Does every tooth that needs a root canal, you kind of addressed infections before, does every tooth have an infection that needs a root canal?
The great majority of the teeth that need to have root canal work, the reason is due to bacterial growth inside the tooth. And it can come from a variety of different areas, as we said, decay, cracks, things like that. There are some cases when teeth just break and they expose the nerve of the tooth when there's not truly an infection involved, but it necessitates doing a root canal on the tooth because of the fact that the nerve has been exposed.
Okay.
But the majority of the times when you have a tooth that has undergone a lot of different restorations in our lifetime, and cracks and fillings and new fillings and crowns, and it's in a bacteria-laden environment, which our saliva is, it tends to allow bacteria to grow in the tooth in situations. And so in the great majority of the times we have some degree of infection. Now infection is different than abscess. When a person has an infection, you can just have bacterial growth inside the tooth. And the abscess is what people think about as the swelling, the painful situations, and that is probably not, that's probably the exception rather than the rule. Those situations are probably 10% of, if not less. And that's a situation that is a painful situation that we have to remedy, and we're able to get the patients comfortable again by draining the abscess and taking care of all the infection.
I'm glad you differentiated, because that is one of the concerns of patients, the difference between an infection and an abscess. And when you say, just one last question in regards to the infection, do you typically need to give them an antibiotic?
We use antibiotics as indicated. Many times an antibiotic is not necessary. And the reason being is because we are addressing the source of the infection. And by cleansing out the infection inside the tooth, you do not need to put the patient on antibiotics. Now, every case is an individual, every person, every patient is an individual. So we have to determine by the patient's health history, by the severity of the infection, and the progression of the infection, whether an antibiotic is indicated. But as a routine, no, we don't use an antibiotic.
And the last question that a lot of people ask is, how long does a root canal last, is how they'll ask it. But I guess a better way to ask that is, once a tooth is treated with a root canal, how long on an average can you expect that tooth to hang around?
Well, it's so difficult to pin a number on that, and I know that it's kind of being evasive, but we would like the tooth that has had a root canal to hold up as long as your other teeth. If the other teeth are involved with cracks and continued decay and gum disease, then just because the tooth has a root canal doesn't mean it isn't subject to those things as well.
Right.
So we like to say that the tooth will hold up, in general speaking, as long as the adjacent or teeth around.
So within its environment, as long as the rest of the environment is healthy, probably the tooth will stay okay.
And current literature will say that we have a success rate of about 90%.
That's pretty impressive.
When we say a 90% success rate, that means that the teeth are holding up for as long as the adjacent.
Okay. So. That sounds great. Well, thank you very much for your time today. This was really informative, and you've answered a lot of questions that I know in our office we get all the time. And so this might allay a lot of fears. It might change people's perception as to what root canals really are about. And certainly you can see that this wonderful gentleman here is so kind and compassionate that he makes root canals actually pleasant, if that can happen. So thank you very much for your time.
Well, I enjoyed spending the time with you, Claudia.
Thank you.
And hopefully, as I said, we dispelled some of the rumors of root canals.
I think we were successful. I think we did it. That was so much fun again. I'm really enjoying doing these interviews. I'm really excited that Dr. Kevin King was gracious enough with his time and his expertise to spend this little video segment with us and answer questions. I hope that you found it helpful. If you have any questions at all or any concerns, anything that relates to endodontic therapy to root canals, please give us a call at our office. We're always happy to help you, or email us at info@parkridgedds.com. That's info@parkridgedds.com. And thank you again to Dr. Kevin King. We loved having him. It was a wonderful time. And for you, remember, as always, we love making you smile.